Okay, so tonight we're going over peptides and GLPs and how you can use them and a little bit about them. They're everywhere right now. I feel like you can't go anywhere without hearing about them. Peptides and GLPs, which are a peptide. And so tonight we're just going to kind of do a brief overview. There's tons of information out there. I can't go over everything tonight, but really the goal here is to give you some clarity, help you understand a little bit more of what is this about? Could this be for me? And where maybe I should look for more information. A little bit about me for anyone who might not know me. My name is Holly Kilcarry. I am a functional nutrition coach and personal trainer. I've been working with women and men for a little over 6, 7 years now. I specialize in hormone and metabolism optimization. I have advanced certifications in gut health, perimenopause, menopause, thyroid health, blood, like functional blood analysis, and peptides. I myself am also a woman in perimenopause. I'm 42. I have 5 children, and I've overcome a lot of injuries and had some health challenges of my own, which really was what started my passion into this. And then the more I worked with women, the more I wanted to work with women. I love it so much. Their struggles are my struggles. I love feeling like I can help them kind of navigate this. I love their successes. I just love the connection so much. So yeah, it's a little bit about me. Um, and who this webinar is for tonight. If you're here, primarily we're for women, 35 and up. That's kind of my niche. It's who I work with. It's probably about 95% of the people that I work with. But also men too, as well, or women that are maybe a little bit younger than that. But mostly it's people who are looking for better health, looking to optimize their health, looking for longevity, looking for maybe weight loss. Or just kind of curious what peptides might be about. A lot of times people have tried everything and they're really just looking for what is the answer, what is going to be sustainable. Remember everything tonight, not medical advice, totally informational, and nothing is one size fits all. That is going to be a big takeaway and kind of a theme tonight is that what might work for one person doesn't necessarily work for others. Why now? Why are we hearing about peptides? Why do I think peptides are important for you to understand? We just know after about 35 to 40, things change. We hear it all the time. We have shifts in hormones. We don't recover as fast. We feel inflamed. We're more fatigued than we used to be. We need more sleep. Our metabolism has changed, and we kind of have this systemic inflammation all over our body often. And that's where we're really seeing a lot of things going on. And, a lot of it, a lot of Americans, they just have a lot of metabolic dysfunction going on and things that peptides can really help for, really be useful for them. There we go. What are peptides? And when I say peptides, GLPs are peptides. I want to make that clear. Some people say GLP or a peptide, but GLPs actually are a peptide. Excuse me. So peptides themselves are a signaling molecule. They are something we already had in our body. They are turning on and off a signal. And they're being used for healing, vitality, reverse aging. They're really a bioregulator and they're targeting in action. So we might have a medication, like a GLP medication is actually like kind of a misnomer, right? Misnomer. We're looking at something here that is a peptide that's turning on or off a signal versus something that's kind of providing a therapy throughout your body. They have a really short half-life. They kind of get in and they do their job and they get out. So they're being used to help repair injuries, inflammation, recover. They're being used for chronic conditions, autoimmune conditions, and then other things like arthritis. We're seeing them used for cholesterol. We're seeing them used for blood sugar support. They're used to support the immune system and for better cognition in your brain. They're being used to regulate metabolism, build muscle, support energy, and then really this whole feeling of vitality and anti-aging. I truly believe, and most of the experts are believing that this is really the future of preventative medicine. This is where we're going. America really has a sick care system, and peptides are really the first thing that we're seeing healing, that we're seeing changing kind of the tide that we have in this systemic sort of sickness, inflammation, a lot of the issues that we have with weight and things, and how we can heal the body and kind of turn the tide on that. I want to make a note about peptide sourcing. This is a big question that I get and a big subject of discussion that I see in the internet. There are two types of peptides. There are two formulations, I guess I should say, of peptides. We have research grade peptides, which are often referred to as gray market or tier two. Currently in the United States, as of January 1st, we're not manufacturing it. The FDA made some changes, so they're not being manufactured in the United States at this moment. It will probably change, but if you're getting something right now, it's likely from overseas. And the easiest way to tell is research grade peptides come to you in a powdered form, and you need to reconstitute them yourself. They're not inherently bad, but the big thing there is you need to mix them yourself. So there's some chance of error, right? You're introducing something when you're mixing it, but also the sourcing. So research grade peptides are not created for human use. They're created for research use, and they state not for human use on them. Again, doesn't make it bad. I like to use the analogy of if you're having some food that maybe someone cooked for you in a kitchen. If you know the quality of the food and you know the person that's cooking it and how well they take care of your kitchen, it's probably their kitchen is probably fine. But if you don't know, then there might be an issue. And that's where maybe you want something that's a pharmaceutical grade or tier one. That's what I work with. All of our peptides are 503A FDA certified pharmacies that you're getting them from. They're pharmaceutical grade. You're not reconstituting them. They're not coming in from overseas. They're from the United States, and they are in that FDA cleared facility, safe for human use. They are also third party verified, which is something you should be asking for if you're getting a research grade. You need to know the pharmacy that it's coming from and know that you're getting some kind of third party testing. There's probably going to be some rollback on that, not allowing the tier two in this year, I imagine. But right now, we're just dealing with tier one if it's a United States product. This is a quick overview of GLPs. There's three main types of GLPs. I put a GLP-4 on there. There's an error. You're going to probably see lots of errors. There's three main types that are out right now. We have GLP-1. This was the first one, and GLPs in and of themselves have been around since about 2005. They're not new. They've been around for 20 something years. We're just hearing about them now. There's been some advances. They've become more mainstream. We're seeing a lot of celebrities on them. Well, a lot of celebrities have been on peptides for a very long time, but we're seeing more mainstream use, more acceptance of them. And those first GLP ones, your semaglutide, that's going to be your Ozempic and Wegovy. That works to turn off food noise. So it's turning off your appetite. That is the goal of that one. Then we have a GLP with a GIP. It's a dual process there. It's targeting two receptors in the body, and that's your tirzepatide, which is your Zepbound and Manjaro. And that one is going to help not only your food noise, but it's also going to help how you process blood sugar. What happens with your blood sugar? What happens with your body burning fat? It really works for a lot of people better than semaglutide. It tends to have a little bit lower of the GI side effects with it as well. And then we have GLP-3 is what it's being called. That is GLP, GIP, and glucagon. It's targeting all three, and that's retatrutide. Retatrutide, there is a lot of conversations about that one. It seems to be kind of the newest, and it's really gaining popularity because it has that glucagon in there as well. And that is really going to help you with maintaining muscle and burning more fat at rest. You can also eat more carbs on it. Retatrutide is FDA approved for clinical trial. In the United States, it will probably become fully approved at some point this year. It will late this summer, maybe in the fall. We don't have a name brand for it because it's awaiting that approval, but we still to get it from our doctors, pharmaceutical grade from FDA approved pharmacies under that clinical trial off-label use. And their GL4 is coming way down the road. That one is going to add growth hormone to it because there's some concerns with muscle loss, especially when you're starting with those first generation GLPs that just shut off the hunger cues. We'll kind of talk more about that as we go through. The big effects of your GLPs are going to be appetite signaling, so telling you not, that you're full, reducing the food noise, which for some people can be really debilitating. GLPs get kind of a bad name, right? There's a lot of people, especially in the wellness space, that feel like GLPs are, taking a shortcut. And we're kind of realizing that that really isn't fair. A lot of people just have less GLP either because of age, because of your genetics, because of your gut health. You have less of that. Or maybe you don't make it as much as you used to. And so we use the analogy of a person and they can see, but with glasses they can see better. So some people need it, and that food noise can be a real issue for people and make life more difficult. So we really need to start understanding that GLPs are a tool. And they're not just for people who are very overweight or, overweight or obese. We're seeing a lot of the term is microdosing, you've probably heard. We're seeing a lot of that to get those benefits with blood sugar and those benefits with even joint pain. We see a reduction in cholesterol, we see a reduction in blood pressure, we see regulation of A1C, and those things can happen without weight loss. I talked to someone yesterday and she had reduced her cholesterol. For her whole life, she had had elevated cholesterol just genetically. So even though she's actually a nutritionist herself, even though she always had high blood cholesterol, high triglycerides, and high LDL. And so then she went on the GLP microdosing and was able to bring that down. So really beneficial things coming from them, not just in terms of weight loss. We just hear weight loss as the first one because the weight loss industry is a multi-billion dollar industry. So we're going to hear it there, but it's really happening in the longevity and preventative medicine, especially when we talk about GLPs and blood sugar being kind of the precursor of inflammation, the precursor of tumors, the precursor of even like things like dementia. Really understanding that managing blood sugar manages everything, and GLP is an incredible tool for that. We have lots of other peptides. I think right now we're offering, I think 53 last time I checked. There are a lot of peptides. They kind of break down into a couple categories. We have healing and tissue support. These are just a few of them. I can't go over all of them, be here all night. But BPC 157 is probably the most well talked about, maybe glutathione. BPC 157, really good in injuries, healing injuries, healing, joint problems, muscle, tendons, things like that. It's used a lot of times in conjunction with maybe surgeries or something like an ortho type injury. TB500 is another healing peptide. It just works in a different pathway. Sometimes we see those two used conjunction in a stack. So if you know anything about peptides, you might have heard a stack. BPC and TB500 together are called the Wolverine stack. Sometimes you'll see those two with the addition of GHK copper, which you see there on the bottom. GHK copper is another excellent healing peptide. It's also called the beauty peptide because it works on collagen production primarily. And so it's helping with hair, skin, and nails, but also with other parts of collagen, which are parts of our joints and our gut health. So GHK copper really can kind of create firmer skin, but really it can help with scar revision. And so scars in people can be very painful. Scar tissue can be very painful. Myself, I've noticed from the combination that I take of these healing peptides with the GHK, that's my scar tissue was entangling a nerve. And giving me a lot of pain. And so I have been on that and I have noticed a dramatic decrease in the amount of pain since I've been on that from that scar tissue entanglement of the nerve. And that for me was a permanent injury, we thought. I'm just not eligible for any additional surgeries. My team at Georgetown has kind of got to the point that like, I don't know if we really want to go in there again, just manage the pain with pain medicine. And so that kind of led me to peptides. Like, can I heal myself? And I have noticed in just a few weeks a sharp decrease in that nerve pain and also that scar tissue pain. Then we have glutathione, which is a master antioxidant. It's present in a lot of processes in the body, really helps reduce systemic inflammation. And we have KPV, which really works with gut health. And so also inflammation in other places, also healing, but we add that a lot of times for gut health. If you hear the glow stack is going to be GHK copper, TB500, BP157. Clo stack with a K adds that KPV. So those are often used in conjunction together. And then we have peptides for longevity, brain metabolism, longevity, cellular support. That's going to be your NAD, glutathione, epithalon. I always say that wrong. Those are helping with cellular repair, mitochondrial function, and sleep. Then we have brain and mood support. We have Selenk and CMAX. They're used for a lot of things in cognition. So we're using them for brain fog, anxiety, depression, just better brain function. They're neuroprotective. So when we look at concerns about dementia and Alzheimer's, memory, forgetfulness, and just a lot of people will lean on something like that if they have like a really demanding job and they need a lot of mental clarity, they need a lot of focus, they run on a really high stress level, they really need to function well at that level. They might consider something in that brain and mood support section. We have metabolic and body composition peptides. So semarelin, tesamorelin, ipamorelin, they work on growth hormones. They help you produce and release. So some help you produce more growth hormones, some help you release more growth hormone. And they're used a lot of times in things like competitors, athletes, bodybuilding competitions, bikini models, people like that. They're also used in people as they age. We just produce less growth hormone, especially women in perimenopause. So it becomes more difficult for us to maintain muscle mass. It becomes more difficult for us to sleep really well, things we used to do when we were younger. And so we're using those and finding great success there. Same with MOTS-C. MOTS-C is used a lot of times in women in that perimenopause space to help with having better muscle function, to help with losing that midsection weight gain. The growth hormone stimulants in general can help with that midsection weight gain. AOD 9604 is another one that is commonly used for those similar like body composition metabolism goals. But they're all tools. So you're going to find people and they're going to list out for you their stack and what they're taking. But you need to understand that what works for them might not work for you because it's really very customized. We're turning on and off signals in the body. So we really need to know which signals you need work on the most. These are some reported benefits that I've heard from people from their direct experience. So you'll find a lot of information about peptides in general and what they do. This was just a short list that I kind of created. We have that lower inflammation, lower inflammatory response. A lot of times people see that in their appearance. So they look more lean, they feel more lean, they have less bloating. Maybe they have less swelling and puffiness, but also we can see it in labs sometimes in inflammatory responses. They have more energy, so they're sleeping better. They're waking up earlier and feeling refreshed when maybe they never did before. They have better, like reduced brain fog. They're able to focus better. They're able to have that stamina either in their workouts or in their daily life. Better muscle composition, obviously, there with your growth hormones and then your GLPs. We're seeing reduced body fat and then higher muscle mass. And muscle mass as we age is our longevity. It is the holy grail. We want it. We want to hold on to it. We want to build it. So we do want to maybe take advantage of those tools that if we have them available. More youthful appearance, specifically here, a lot of people report that because they have reduced inflammation, they have more of a glow. Maybe they're getting better collagen production, so that's helping their skin. It will absolutely, have people tell me that they look younger, that their face just looks, the skin around their jaw is maybe a little bit more defined. Or maybe they had, spider veins or stretch marks or things like that, that potentially the peptides could have helped with. We have a reduced risk of certain diseases. So things that stem from high blood sugar, long lasting A1C can be really bad for you. Things that stem from inflammation. There's a lot of discussion about cancer being a root cause from inflammation. And lower cholesterol risk, which is reducing risk of heart disease. There can be benefits in terms of helping in the liver and things like that we see as well in studies. Most people don't realize, and what I hope is the takeaway from tonight is not just the information about the peptides, but that implementation and the way you manage it is everything, right? Peptides are amazing, but they are enhancing what is happening in the body. They are changing signals within the body, which means you need to be careful which ones you're using and if they're being used appropriately and managed because they're an investment, right? So we want to get the most out of them if we're doing peptides. We want to get the most healing, the most bang. Also, so that we're not on them for longer than we need to be. So if something maybe is normally runs a 6 week course, we get the most out of it. We don't do it well, it takes longer. Same thing with weight loss. And maybe it takes us longer to get where we need to go because we're not managing it appropriately. Or some of them, especially when you're looking at some of these GLPs, if they're mismanaged, you can end up worse off in the long run. And that's not what we want. We don't want anyone coming in to this and ending up in a worse place. And that is kind of why you're seeing a lot of nutritionists, functional health specialists really leading the way with these peptides now. Because there's a lot of people out there prescribing peptides or putting people on peptides or sending them in the mail. A lot of companies doing that and not managing it properly. And that leaves you worse off. You can see muscle loss, which again, I cannot stress enough. There's one takeaway you take as a woman in perimenopause is that you cannot afford to lose muscle. It is so difficult to gain muscle as a woman, as a man as well, especially as a woman over 35. It is just difficult to gain muscle. And so we cannot afford to be losing muscle at the rate with which people are losing muscle. When people go on these GLPs, especially if it's just blunting their appetite, if you're not eating properly, if you're not supervising yourself and what you're doing, you're going to lose muscle and gain back fat. And that is going to put you metabolically in a worse place, but also physically, right? Your muscle mass is your survivability of all cancers. It's your fall risk. If you fall as a woman, a lot of the time you don't end up going back to the house you were living in when you fell, especially if you're over the age of 60. You need some kind of modification. Maybe you end up in the hospital with a secondary issue because you were there for a broken hip and then you got a pneumonia or you got something else while you were there. So important to maintain your muscle mass. So important to do it appropriately. It also helps prevent that like dull appearance, like a sunken face, or dull skin, losing the glow. You get nutrition deficiencies, so we get hair breakage. We can get vitamin D deficiency. We can get lack of bone or loss of bone density. Um, we can get B vitamin deficiencies, iron deficiencies. We can get fatigue. A lot of those things are coming from the deficiency. So really making sure you're monitoring your lab work so you can see what everything looks like is super important. You can get that rebound weight gain, right? So if you could lose weight too fast and then you come off of it without any real plan or strategy, you're just going to gain it back. The wrong order. We see that happen too. I absolutely will have people come to me that are needing to lose weight, and GLP is maybe not the first choice for them. Whatever is going on in their life, in their diet, in their lifestyle, something with their labs, maybe we need to heal first, and that is going to give them a better result, a more lasting result. Poor peptide quality also. If we're getting something that's maybe a research grade from overseas, maybe it doesn't do anything. So I hear that a lot. People will come to me and they'll go, "Oh, I tried that. It didn't do anything." The first thing I say to them, "Well, did you reconstitute it yourself?" It's always yes. The answer is always yes. If someone comes to me and it didn't do anything at all, it's because it was a reconstituted tier 2 research grade peptide. You can also get those and reconstitute them improperly. So you can put too much water into it, not enough water, so that maybe messes with your results, or you're not maximizing your an investment, right? Anything is an investment. If you work with a coach, it's an investment. You join a gym, it's an investment. If you buy a package of protein shakes, it's an investment, right? And you're wanting to get the most out of it, which maybe isn't happening if, it's just some one size fits all company that's putting you on it. Which is why coaching really matters. And you can coach yourself. It can absolutely happen. You can stay on top of it. You can manage it, right? What we're wanting to do that changes everything is this, right? We're wanting to do strength training to protect muscle. We're wanting to get stronger, maintain that muscle, make sure we're eating enough protein for that muscle. We want to do nutrition support to make sure that we're not getting deficiencies when we're under eating. It also is really important to know that most GLP side effects come from the way that they're being implemented and that they're implemented improperly. Most of the GI side effects come from eating the wrong types of meals or the wrong volume of meals or the wrong timing of meals. It's not actually the GLP itself. So they get this like really bad name for all these bad things that are happening to them. And then if you look into it, if you were working with a nutritionist, you probably would have been fine. Because you're not eating enough, or you're not eating the right things, or you're eating too much, or you're eating too much too quickly, or you dosed up too high. There is no reason to be going to a really high dose out of nowhere. And that's happening a lot. People are getting put on the highest dose out the gate. Then they're having all these side effects. They might be losing weight, but they're losing weight because they're throwing up, which we know is not a healthy way to lose weight, right? Like anyone's going to lose weight if they get the stomach flu, but we all know, like, common sense tells us that's not lasting weight loss. That's not going to put them in a better place. So that isn't going to be the goal. Um, we need to monitor things, right? If you take a GLP, you want to be monitoring everything, and it allows you to titrate up and titrate back off, which is all very individualized. This person might get side effects, this person might not get side effects. This person might be able to eat this person might not. We also see sometimes things like food intolerances are exasperated with GLPs. So it might not be the GLP itself, and that might be something that you could spot if you were looking at what you're eating. What I'm seeing over and over and over again with GLPs is that they're being used as a shortcut, but women aren't looking for a shortcut, right? Most women aren't saying to me, I want to lose weight as fast as I can. I want to just drop it off no matter what it takes, no matter if it comes back the second that I stop. Most people don't want that because you're tired of being in this same cycle year after year after year, right? You don't want to just lose weight and then be there for 1 month and go right back. That's what not people are not looking for, but that's what's being given to people. What is being given to them is a short, quick fix that isn't sustainable and isn't done properly. So most people really want to feel strong again. They want to feel like themselves. They want to feel comfortable again. And you can do that with GLPs very, very successfully if you're monitoring it and applying it appropriately. That is the real secret, right? It is like any tool. A tool in the hands of a novice is not going to give you a masterpiece, right? So we need to look at the tool and we need to look at how is it being implemented. These are some examples of people that I wanted to put in here for you. I went back or forth. Sorry about that. Here's some examples of people that I want to put in there for you. One is BPC 157. We see this used a lot in athletes. It is used to help them heal from injuries. It has helped them recover from the wear and tear. It is in a lot of professional settings. Currently, it's banned during in season, which I always think is great because people love to say it doesn't do anything. And I'm like, well, why can't they use it when they're playing football games? But we see it used in that orthopedic settings. There's a lot of data behind it with like knee pain, chronic knee pain, showing that not only did it reduce the knee pain, make the knee pain go away, but 6 months after discontinuation, most of those people still had no knee pain. So that's really excellent, showing that healing process. We see the same in gut health with people able to heal their gut. The next one is an example of a woman, perimenopause. I think she was 43. She was stuck at 160 no matter what, eating healthy, lifting, hitting her macros, hitting her steps, just could not move the scale no matter what happened. Lab work looked fine. Ended up getting a frozen shoulder. So that frozen shoulder was giving her a lot of pain. And that happens a lot with perimenopause. We see frozen shoulder quite a bit. And she was able to have a peptide come in, BP 157, as was one of the things she was on, reduce that shoulder pain. So she went to being able to press overhead again, which was wonderful. I mean, we talk about not being able to exercise to being able to do that. But then also she was able to, heal her gut, heal her body. We got her sleeping better. They got her better muscle comp, and she ended up coming down 12 pounds after being stuck at that 160. And most of that actually was body fat. So on DEXA scans and photos, you could see she was getting stronger. So that was excellent for her. Um, excuse me. I talked too fast and then I get really thirsty. The next is actually oncology nurse and cancer survivor herself that was looking for longevity. Just had a concern of being the healthiest version of herself. How could she live the longest? What she currently stays on is the Glow Stack that I talked about, and Cimarelin, which is a growth hormone stimulant, and that is helping her reduce her inflammation, have better skin, feel longer and stronger, able to manage that really high stress environment that she's in, and do it in a way that has led her to be healthy. The next example is someone with GLP. And she is down 40 pounds, watching DEXA scans again, and her muscle mass and her weightlifting. She is really losing body fat and gaining muscle in this case, which is just so amazing in terms of her life expectancy and her life quality. So that is just a real success. She's also got a lot less pain in some of her joints. And there's the question, just like with the cholesterol, the question is, well, is it the GLP or is it the joint pain? It's probably a combination of both. No one can tell you exactly what percentage it is for either one, but I think at the end of the day, what matters is that, when you can walk a long distance without pain, when you can get in and out of things without pain, and you're down weight, I don't know that you really care which one caused most of it. The point is your quality of life is improved. So again, the missing piece really to peptides, the thing that is most important, whether or not you do it with, a coach or by yourself, is that it really needs to be customized to you. There's a lot of internet protocols out there. You can, now that you've been talking to me, you're probably going to see a lot of them out there that say, oh, take this stack, take this blend, take this, it's going to fix everything. It really depends on where you are. You need to see where you are to get a map to where you want to go. Because like if I'm looking for, the way to get to Florida and someone hands me a map of Europe, I'm not going to get there, right? So I need the map that's appropriate for where I want to go. Also, people are being put on way too high of a dose for some reason. Oh, I know the reason, but they're going up every 4 weeks. We're just raising the dose. Well, if you're losing weight where you are, stay there. There's no reason to go up. You're just going to increase your side effects. So stay where you are until you plateau. There just isn't a reason to push people into these really high doses. They just get higher side effects, and then you have to come back down slow. So it's just prolonging your time. I know with Retta, there was a big study that came out, weight loss in Retta, and the dose they had on Retta, like appropriate clinic, appropriate physicians that we work with are not getting people to that dose. Like if you followed the math, they're not getting the dose, I think the doctor said, until like week 44. We would never have, there's no one that's on it that long, right? They're not on that level that long, but that's the place where people are bringing them in. So why are we there? We're just creating a bunch of side effects. Recommending several at once without taking note of where you are. We don't want to start a whole bunch of things because then if it's helping, you don't know what it is and you're just on a lot of things. So really understanding, do not start with five peptides your first month of peptides, right? Like, let's see what you need to do, which leads me into the last one, not healing first. You need to heal your body first before you expect it to do anything, right? So we don't want to come out and try to just make the body lose weight, yell at it to do more if it isn't healed. Sometimes it doesn't work at all. But if it does work, it's not getting there the right way. It's less likely to be successful. It's not going to move as fast. Your quality of life is maybe going to go down. Your biofeedback is going to go down. That's kind of your mood, your sleep. So we don't want all of those things to be impacted unnecessarily because you're having like improper implementation of your peptides. And that's why this personal strategy really matters. Really important to understand you individually. It kind of stops all that trial and error. Like you don't want to spend a year messing around with these things trying to figure it out. You want to see where you are. You want to find that right map, which is exactly what I do. That's what I do with women and men. We look at lab work, we look at your symptoms, we look at your diet, your exercise, your lifestyle. I usually ask people, what one or two things do you want me to change? Because it's very easy when you start looking at peptides to go, wow, there's a peptide for everything. I should take every one. No, maybe we cycle around, but I usually ask people like, what is the one or two thing that's really impacting you the most? Which is why I offer free strategy sessions, which is not a pressure thing. You can come in, we look at your history, your symptoms, your lab, you leave with next steps no matter what. I'm a firm believer that it has to be a good fit, right? You have to want to work with me. I have to think that I can actually help you. There's enough people out here just handing out scripts, right? That's just not me. What I want is for you to understand why I want you to be in control of your health. You need to be the one making the decisions behind things with all the information. So that's kind of my philosophy because you know yourself better than anyone else. The doctor doesn't know your body as well as you do. I certainly don't know your body as well as you do. You are in your body. You know what it feels like. You know what's bothering you. You should be in control of that. And that's my personal philosophy and my approach, which is not for everyone. And so, you know, the purpose of the strategy session is just like this webinar. It's to give you information so that you know, where am I? Where could I possibly be? How could I get there? And then if it decides that it's a fit and we work together, great. If not, either way, hopefully you leave with more information. Just like hopefully tonight you left with more information. Um, I'm going to just open it up to any other questions, but mostly I just really want to say thank you. Thank you for taking the time to listen to me tonight. I really just feel so blessed to be able to spread information with everyone and to help them understand this technology because it really is, I believe most of the wellness people, all the people that are within our big network believe, and you know, we have a lot of you know, professional fighters, we have surgeons, we have oncologists, a lot of like really smart professionals we're working with, and everybody is just so excited about this advancements. I mean, it really is maybe the first time that it's going to become a healthcare system, right? Preventative medicine, healing the body, not constantly playing like catch up with people who are sick. And we saw that with GLPs. This past year was like the first year that the obesity level and the overweight issue with America went down. And that's not a coincidence. I'd love to say it's just because there's so many wonderful functional nutrition coaches, but it really is how we're implementing these peptides, how we are interpreting lab work and creating profiles and what all these things are doing for them. And the goal is that not just do we have people that lose weight and lower their cholesterol and feel better, but that they stay there. And that's really what we're able to do with peptides, whether it's with me or anyone else. So, yeah, I'd love to have you book a strategy session if you want. It says limited number because obviously there's only so many slots just from a time perspective. But you know, if you have other questions, feel free to shoot me an email, and I can hopefully answer more for you, or you can ask questions now. Perfect. Well, that's it. I hope that that answered everyone's questions. I hope that you learned a lot tonight. I certainly appreciate you so much. And again, I'm Holly Kilcarry with Holly by Holly. And if I can be any help with this or anything else, please don't hesitate to reach out.